think we've all seen through Instagram and some of the meetings that we attend before COVID and now virtually that really the rhinoplasty with filler is becoming more and more commonplace, but it's also an area of potential pitfall. So I just want to go through with you guys your approach in advising patients what can be done with fillers.
And I do a lot of liquid rhinoplasty, and I started out being pretty scared about this procedure and very fearful, and of course, never always knocking on wood and doing a deep breath and a Hail Mary before I begin. And we all should, because literally you're playing Russian roulette every single time you do a nose. So, first and foremost, a lot of caution should go into the idea of doing a liquid rhinoplasty. And secondly, I'd recommend anybody who wants to begin on this know their anatomy as well as if they were a nasal surgeon, because so much of what you're going to do is with the tip of the needle and the feel of where you are in terms of depth and plane and anatomic structure. And then lastly, like once we have said these scary things, I think it's such a successful procedure that it brings such great joy, and it's so fast. It's 15 minutes. It's you have to be very precise with very small droplets of filler, and it's a very artistic thing, but I've been lucky to have great results where I almost feel like it rivals what I can do in surgery. It's better than surgery because it's so predictable, reliable, and adjustable. And with this Instagram generation, perfection is like, they think it's a filter. It's surgery. It's really hard to deliver. If you've ever done rhinoplasty, it's very hard to do.
Michael.
Yeah, I think in addition to really understanding the anatomy, it's understanding the aesthetics of the nose. And it's one thing to say, yeah, I know where the tip cartilages are, I know where the nasal bones are, but understanding what's a good proportion to the nose, what's appropriate rotation and projection of the nasal tip, all comes into play to what the patient is ultimately looking for. Because regardless if they're coming in as a surgical or non-surgical candidate, they're still looking for the same principles that you can deliver for a surgical result. So I think that is huge when looking to start, injecting noses with filler. I only use hyaluronic acid in the nose for when I do non-surgical rhinoplasty. I know some colleagues use Radiesse. I have seen other people use Bellafill, and I would really highly discourage that, because if you ever get into any problems within the nose, and the risk is much higher in this area of the face, you want the ability to reverse it with your Hylenex, because you don't want to fall into skin necrosis or anything like that. I only use a BD syringe, and I do inject very tiny aliquots, and I always stay in the midline about 99% of the time. There's very, very small incidences where somebody will come in that has had a rhinoplasty before and they don't want to get another one, and they have a small little asymmetry or something within the lateral nasal tip. And I approach that area extremely cautiously and tell them that I'm only going to put small amounts in there and can very conservatively help that area.
So my most common nasal patient are patients that have scars from previous skin cancer surgery. So I did a Mohs College fellowship, and whether it's a flap or whether it's a graft or sometimes a linear closure, I think that there's people who do have imperfections. And having said that, if somebody's looking for a really high volume restoration that has had a scar and it's unpredictable vasculature in the area, then I really approach that hesitantly for the reasons that have been mentioned. But for people who have very, very small imperfections where 0.2 cc's of filler may actually be helpful, if it's more proximally on the nose, then I'll probably do that. Distally on the nose, as we get towards the alar rim area where there's very little blood supply, you're really relying on the lateral nasal artery primarily and a little bit from the dorsal nasal artery. I will do what I've published on is called a dermal graft, where I'll actually take a couple punches from behind the ear of 3 or 4 millimeters. I'll cut off the epidermis with an 11 blade, and I'll actually create a little bit of a pocket with a subcision no core needle and put that in there. And that actually is something that is durable for many patients. It really achieves the correction you're looking for, but you don't have the risk of getting into a vessel that is going to cause problems later on. So Corey, you must have these questions very frequently. This has become so popular on Instagram, and elsewhere. How do you approach the patients that want nasal augmentation?
Well, again, like Kay said, I have a very healthy respect for the anatomy and vasculature of the nose. I believe in doing small amounts. I believe in being very conservative and going very slowly. Fortunately, most of the patients that I've been able to treat for nose issues are coming in with one specific problem. They have a little notch that they want to correct, or they have some asymmetry that they want to balance, or something like that. Obviously, if it's a request that I feel is, out of my hands, or what I think goes beyond what a filler can achieve safely, then we're going to refer that to a plastic surgeon for correction. But also having that conversation about how important the nose is to the overall structure and balance of their face in general, and how that can contribute to a look that is pleasing and natural as an end result. So in that context, I try to keep it in that context. And I also remind the patient that this is an area that we're going to be very conservative with as well. And I only use HA fillers, and I do not use cannulas in the nose either. I know that that's another trend. That makes me nervous.
And then Shino, our nose is getting to be very popular in South Florida. Are you doing a lot of this? Are you really focusing on cheeks and temples and overall augmentation?
Of course, it's popular with everything that people see on social media, but I tell you what, I don't worry about it because I don't do it anymore. I used to do everything that, Kay, Michael, Joel, yourself, Corey have said. I second everything, but, at 52, I decided that I don't enjoy doing this procedure. I was like, like praying. I would tell the patient, I don't care what time it is, 3 in the morning, anything that felt normal, just call me, call the service. And, deciding not to do something that you don't enjoy doesn't make you any less of an injector. So I now like to do things that I love to do, and things that I don't love to do. I have tons of friends that love doing them, so I refer them. But back in the day when I did it, I didn't touch noses that have previous surgery, only virgin noses with tiny little small defects. I would stay on the midline. And again, I pray to every saint, Jesus, Muhammad, Allah, everyone I could mention that night that nothing wrong could happen, and thank God never did. But I don't enjoy doing them anymore.
So, and we're going to do rapid fire. I just want your perspective on something from an office efficiency standpoint that you think could be actually done better, or something that you might be able to help some of the folks listening. I think when Ed Williams and Roy Geronimus first published articles about using pulse dye laser to treat bruising, a light bulb went off, and I was excited. I brought these patients back in. I said, hey, you've got bruising, come back in. Now, several years later, we're to the point where if somebody's had bruising and they've had me treat this area with pulse dye laser before, and sometimes they preventatively schedule a pulse dye laser appointment the next day or 2 days later. Obviously, that's not fair to the schedule and the best way to do it. So I often tell them, hey, it's possible that we'll be able to see you at some time tomorrow or the next day. It's probably more likely I'll see you over lunch or at the end of the day when I know my colleagues are not using the pulse dye laser. How do you guys approach this, and how do you advise your staff to schedule this issue of post-filler bruising, especially in somebody where you've actually improved the appearance of the bruising with a laser light-based device in the past?
In my practice, and this is a piece of advice that I tell to everybody that has an aesthetic practice, everyone that has an aesthetic practice should have a red light, 633 nanometers. I don't have to worry. I don't even sweat it when somebody gets another reaction, whether it's inflammation, whether it's a bruise. I don't even have to see them. They call in, the patients already know, they call, they go into the red light and they leave. This 633 nanometer wavelength, it is shown to recruit macrophages, so it helps with the bruising. They resolve faster. It reduces inflammation, and it is also used to make the fibroblasts to thrive and make more collagen and elastic fibers. So even if you're doing most surgery, Joel, If they come with an adverse reaction, something is not healing, I promise you, you just put them 20 minutes under a red light and they will feel significantly better and they will heal a lot faster.
Well, one tip that we've learned is to have as much of the neurotoxin drawn up in advance as possible. The girls know I use BD syringes and I dilute. They know my dilution, generally 2:1 with Botox. And so they can draw up the syringes in the most common amounts so that and then we label them by neurotoxin and we put them in a cup with, how many units it is. And that way, when it's a super busy day, I do this thing called Breezing for Botox where patients can come in on Tuesdays and Thursdays between 9 and 1. I don't know how it works. Sometimes 15 people show up that are extra to the schedule, but sometimes somehow we make it work. And I think it's because of little efficiencies like that. Patients love that convenience. They love, it's like a thing now. I should trademark it around here at least because they tell their friends, you can just breathe in. And so that's a tip that helps me to be more accessible to our patients and to deliver that extra level of service that they have come to expect.
Great. Okay.
Yeah, this year I'm trying to change the way we book patients so that once I see them, they get an initial beauty plan, and then I want to book them 3 months out for the whole year. So they're going to get their 3 visits for the whole year right when I see them. Because otherwise it's hard to remember to book. And I want it to be like you go to the dentist and he gives you your appointments and you're set for the year. And that way they have a 3-step beauty plan, 3 appointments. They can come in and do little baby steps. They feel good about it. We never forget. It's working. I recommend it.
And Michael, what about the politicians of DC?
God, how long do we have? I thought we were wrapping up. One of the things that I think is really important for people that are just starting out with injectables or even that are looking to make their office more efficient is, we obviously see a very high volume of patients. All of us do. And so that leads to a lot of calls post-visit about questions or concerns about their filler or their neuromodulators. And my staff is very well versed to kind of empower and educate the patients to wait the full 14 days. And we really stress that with everyone. Nobody gets back into the office to see me after an injectable, obviously pending some emergency or whatnot. But if they feel like they have a brow asymmetry or if they feel they have one filler that's a little bit higher on their cheek than the other, I make them wait that full 14 days because in about 95% of the time, it resolves on its own. It reduces the amount of unnecessary follow-ups in your schedule, and it reduces the amount of annoyances on their part for feeling like they have to come back to get something to get looked at.
These are helpful tips. So I appreciate everybody being with us today to discuss their practice and the way they use fillers and the way they approach different patients and some of these pearls.